Thank you again for joining us. And just as a way of introduction, my name is Tom Cooper. I'm director of the Hamilton Roundtable for Poverty Reduction. And our organization has been really concerned about the need for social assistance reform in this province for a long time. And we've worked with an incredible group of community partners, and some of those are co-hosting today, including ACORN Hamilton, Social Planning and Research Council, the Campaign for Adequate Welfare and Disability Benefits. And we'll talk a little bit more about those individual organizations a bit throughout this program. And Sally as well will join us right at the very end to talk about next steps too. Has Sandy been able to hop on with us yet?
Yep, I'm here, Tom.
Hey,
yep.
Sandy, how you doing?
Good. I think my name says Michaela, but I'm Sandy Shaw, the MPP for Hamilton West, Ancaster, Dundas. And pleased to be here. I know that we have some fantastic speakers tonight. And I mean, it's great that we've done this 3 times, but it's also, it's unfortunate that we are not here to celebrate some successes, but I know that all of us on this call will be continuing to keep up the fight and keep up the pressure to make the changes so that, everyone sees this kind of justice and adequate income that they deserve.
Yeah, absolutely. And thank you, Sandy, as always, for your leadership on these critical issues. Our first presenter today is Dr. Peter Graefe, but he's really part of an important, extraordinary team that's been working not only during the pandemic, but really in the couple of years since post-pandemic to look at income security from a few different perspectives. Peter, along with Mo Ferdosi, Dr. Wayne Luchek, Dr. Stephanie Ross, have really been taking a deep dive, looking at the challenges faced by people on social assistance throughout this period. And I don't know if you had the chance to read their joint op-ed in The Spectator the other day, but certainly an eye-opener. And Peter's here to talk to us a little bit about some of their research and what they found in surveying a number of people across this province on social assistance. So I'll turn it over to you, Peter. Thank you.
Thanks, Tom. And, while I'll be presenting this research, on behalf of, Doctors Ferdosi and Luchek and Ross and myself, really, the voices that are the most important in the research we're doing are those of the people we spoke to, of people surviving on Ontario Disability Support Program benefits. And in many ways, our report is an attempt to bring their voices forward in a document that hopefully many of you here can use in your advocacy work going forward. It was shaped a lot by our discussions with the Hamilton Roundtable, including the organization of a feedback session this summer to try and strengthen the line of those voices. And so, what we did in this report, and what the Roundtable asked us to look into, was a question of how were people on social assistance doing through the pandemic and coming out the other side of the pandemic. And, it started with a survey that we did in the fall of 2020. And Craig, maybe I could see slide 1, where we looked and asked people across Ontario about the first 6 months of the pandemic. And, what was we surveyed nearly 1,000 people and asked about their physical and mental health, their financial situations, their food security, their housing security. And, across all the categories, people on social assistance, and here we had a small number of people on OW answer the survey, a more substantial number on ODSP. So these are the amounts for ODSP recipients in purple. Were systematically far worse than people who had received the CERB during the pandemic, which is the orange bar, or people who had remained in work, which is the brown bar. And that goes, right to say on the far right side there, over half of the people in ODSP who responded to our survey, noted days without food, as compared to just over 10% of people who had received the CERB. And so our interest, and I think of the Roundtable, was to say, well, did this continue I mean, there's reasons why at the beginning of the pandemic there might have been additional challenges, but as we got into the second and third years of the pandemic, did this continue? And so what we did in the fall of 2022 was to interview a number of the original respondents who had been ODSP recipients, and to ask them about how was it like to walk through that time? What got better? What got worse? What were there important moments or changes in their experience over that time? I guess I would kind of underline maybe four things in this presentation. The first was that there were many losses for this community during the pandemic, and losses that weren't compensated with any kind of benefits in the form of the CERB. There were a lot of extra costs at the beginning of the pandemic, in terms of, a loss of access to shopping in a way that you could shop in a manner to save money, a loss of services and community services that would help one get by, a loss of medical and therapeutic relationships. For some, a loss of housing, particularly those living with roommates and may have had issues if they were immunocompromised or with roommates that wouldn't have followed rules. And so in many cases had to give up housing and find housing that was then more expensive and often of less good quality than they had before. And for some as well, there was a loss of income in terms of part-time jobs or small jobs that were important in terms of getting by. And so for most of the people we spoke to, this was entirely uncompensated. With the exception of two respondents who got the CERB, and this would, I guess, be the second thing that would be worth underlining, was that the people who received the CERB had a very different experience of the pandemic than people who were surviving on ODSP. They spoke of kinds of benefits that would be familiar to those of you who followed the Basic Income Project in Hamilton in terms of reduced levels of stress, capacity to plan, capacity to budget and make longer term plans. And so there, that was an important, there's not enough people who really answer that to make strong conclusions, but it's very suggestive that an income level about $800 above ODSP benefits has a significant impact on people's capacity to participate fully and to develop plans and achieve them. So that would be the second thing. Over time, things did get better, or at least better-ish. Stores reopened. There was a capacity to resume jobs, small jobs or part-time jobs as things reopened. Community services reopened. It became easier to have a contact with doctors and therapists. In many cases, this was pretty slow, though, and there was frustration that in many cases, stores opened much faster than you could get back to a therapeutic relationship or back to back to having community services open, though a recognition of why that might be. But in most cases, there were still ongoing losses that people were feeling. Certainly for those who were immunocompromised, things were not back to normal in terms of the ability to participate socially or to consider employment or even to go back to shopping. But also in many other cases, people had lost important forms of community connection. So things like a community choir that shut down, when the pandemic started, or a sort of a break of a relationship with their faith community as that had disappeared for a couple of years. So there were some important connections as well that people had lost. So things, were getting back to normal or getting better-ish on those fronts, but in many cases, there were still some ongoing losses. I guess the third point, though, beyond that, was that despite that, almost everyone we spoke to found that things had gotten worse. And the things that were really causing things to get worse were food inflation and secondarily, the run-up in rents. And I don't think that's a surprise to anyone here, but it was, the extent of the increase in food inflation with social assistance benefits that didn't increase until 2022 for people on ODSP and still haven't increased for people on Ontario Works since 2018, really made it impossible to square the budget. And Craig, if there's a second slide, and that'd be a good time now. Ontario cities stopped doing the cost of healthy eating over the pandemic, but came back and started doing that in 2022. Sorry, different regional health departments. They changed the way of calculating it compared to their earlier way of doing it, so we can't draw comparisons from before the pandemic. But nevertheless, when we look across the province, almost everywhere, the price of food plus rent, without looking at any other expenses in one's life, is already greater than an ODSP benefit. You're already halfway, to a next ODSP benefit if you're trying to survive in Toronto, and about a quarter of a way through it in Ottawa and other parts of the GTA. So it's just the numbers don't add up, and the stories we heard, and we reflected a few of them in the report, but there were many of them. People would spend a lot of time talking about how they budgeted in the past to get by, how they put money aside every month for a couple of years to afford, say, winter boots every 2 to 3 years, and how that money was now all gone. It had to go to food, and even when it went to food, people were eating less. As one person said, they couldn't, they had no way to borrow money, so they just ate less, and they carried the debts in their health. And I think that's kind of telling of what we saw. Again, for a long time, we've been arguing that these programs ultimately are starving people into ill health, and I think that has become even clearer in this moment. I guess the fourth thing I would say is that in addition to this question of insufficiency of incomes, there was a real sense of abandonment by the people we spoke to. Almost every single person we spoke to noted the exclusion from CERB of people on ODSP, and how this was a real sense of being marked out as somehow not belonging to the community. And I think this sense of abandonment was reinforced by just a lack of action when faced with these increasing prices and no movement to improve benefits ahead of 2022. And even there, with the increase we saw then, and now with the indexing of ODSP benefits in 2023, there's still a loss compared to 2018. And that's not talking about the losses that in the individual years between 2018 and 2022. So the end of our report is looking at questions of policy. Certainly there's plenty to talk about there. The Hamilton Roundtable has long insisted on the importance of evidence-based social assistance rates. I think that would clearly be an important way of ensuring that social assistance match the actual costs of living in our communities. Clearly also with the run-up in rental prices, the importance of protecting tenants becomes much more important on the provincial scene. And finally, we've had a lot of talk about labor shortages, but I've seen very little talk about serious efforts at accommodation in the workplace. If there really was an importance or a time when you could think about the importance of that, it would be at a period of labor shortages. But there's been a strange silence about that beyond the increase in the personal exemption or the work exemption that we saw announced last fall. Federally, obviously, social housing also of great significance, but we're also at this moment where the federal government adopted a framework legislation for a Canadian disability benefit in June. I know there's a lot of debate within the disability community about how to be thinking about this moment, but clearly advocacy to ensure that real money got put into that program, and that it was designed in a way to be inclusive in terms of the definition of disability and the manner of dealing with provinces is really crucial at this stage, because I have my skepticism about the political will to make this happen on the part of the federal government, but to the extent that something happened, it really would be a game changer in terms of income assistance for people with disabilities in this province. And so I think that's also an important place to be looking. So that's more or less a report. I suspect not much of surprise to people in this room, but I think there's certainly some use in it in terms of an advocacy tool and using it to push on these various policy fronts in terms of ensuring greater adequacy. And perhaps on the longer run, I mean, I think the impact of the exclusion from the CERB is really important in terms of the morale and outlook of people on ODSP. And I think it maybe is an important point to mobilize politically. So that's what I would have to say today. I hope I didn't take too long, and I'm really excited to hear what the other presenters have to say today.
Peter, Dr. Graefe, thank you for this. I know you're right. It's not probably a surprise for all of the advocates here and the legislators here, but it is a tool that I know that I can use when I'm in the legislature to make sure that what we are saying is completely inadequate, is backed up with data. So I appreciate that. It really does. It does help. And you know, the experience of people living on CERB and the people on ODSP, and showing why we are advocating for a guaranteed livable income. All of those pieces are powerful for us. So thank you for that. And I think some people were asking where they can get a copy of the report. I don't know if you put that into the chat, or so I think other people would like to have access to that if that's possible. So thank you.
Yeah, well, it is in the chat. But
oh, good.
also,
okay.
If one contacts me, or I'm sure Tom, we can also send that out.
Okay, thank you. So it is absolutely my honor now to introduce Denise Davy, and I haven't seen, you're online, are you, Denise? Are you there?
Yeah.
Hi, how are you? So Denise, we all know her as a nationally recognized journalist. I actually know you a really long time. I knew you when there used to be an office at City Hall for spectator journalists. So that's how long that goes back. So yeah, I've known you for a very long time. And I just wanted to say thank you for all that you've done for us in keeping us informed when it comes to your award-winning journalism. But your recent work, your book, I happen to have it here. It's showing. Her name was Margaret, about Margaret Jacobson. This was a difficult but important read. I also have to say I got it in the Ontario legislature. So I just wanted to say that this is another way for us to understand the real lived experience of people that are homeless and living on the street. And I want to thank you for that. And I'm looking forward to what you have to say about this. And thank you very much, Denise, for being here with us tonight.
Thank you so much, Sandy. Thanks for that nice introduction, and really glad to be part of this discussion. Very well organized that I follow Peter, because he presented a lot of interesting statistics and numbers. And the reason I really wrote my book actually was to humanize homelessness and put a face to it. And that's exactly what I did in choosing Margaret as well. And one of the reasons is we can't forget the people that are behind those numbers, because I came across so many studies and finally thought I just need to go out and find somebody who actually is affected by shortfalls in the system and see exactly how they're surviving and what life is like on the street. So to briefly tell you about Margaret, when I met her, and that is the photo of her with the night that I met her. I asked staff about her, and they told me, shockingly, I thought she was probably in her 70s, and she's 49 in that picture. I don't know if you can see over my shoulder, a photo of her as a young child. And the reason I included that was because it's so important to remember when I talk about humanizing homelessness that every homeless person on the street started out as someone's child, someone's son, and someone's niece. So they're all people who started out in, like Margaret's tragic turn happened in their life that they ended up as counting among one of the homeless. And boy, she is surely an example of how the system failed her. In so many ways, because she was smart and feisty and funny, and really I just have so much admiration for her. And the more I dug into her story, I thought she just had so much potential, and to see the tragic end that she came to was very sad. So yeah, just to add about exactly what happened to her, she was really caught up in deinstitutionalization and the closure of psychiatric hospital beds that began in the 1960s. And another way, a huge public policy decision that impacted tens of thousands of people across Canada and actually across North America. And they basically moved people into these rundown rooming houses, and which would have been sort of okay on its own because the advent of pharmaceuticals had made some of this possible. The problem was they didn't put any supports in place. So people like Margaret went from 24/7 round the clock care in hospitals to absolutely nothing in these homes because operators had no training. If she had a caseworker, the person never showed up at these rundown rooming houses. And it doesn't take a rocket scientist to figure out what would happen. And what would happen is she often went off her medication. She stopped eating. Her health would just tumble down into nothingness, and she'd end up back in the hospital again. So her files are 869 pages from the Hamilton Psychiatric Hospital, and they just show this downward spiral of this woman's health getting worse and worse and worse as she was moved into the community, pulled back in, often by ambulance to the hospital, put out again into the community, and put back in again. And by the time I met her, she'd been on the street for 10 years. So that's from the age 39 to 49. And how she survived is really anybody's guess because she was actually one of the longest surviving homeless women in Hamilton, and somehow made it through the freezing cold nights. And she had so many health issues, and yet she was so mistrustful of the system at this point because it had let her down that she often refused to go into shelters. And even when she did have a home, she had a boyfriend for a while named Bob. And even when he did provide her with a warm place to live, she often would just leave in the middle of the night and walk the streets in the freezing cold. And it was just embedded in her. And her story really is an example of how you need to catch homeless people when they first arrive at shelters. And I know that's what Medicine Hat Alberta has done, is that the first 3 days that someone arrives in a shelter, they find out their situation, what they need, the type of housing, type of wraparound supports that they can give them to prevent them from ending up on the streets again. And again, she is an example of the sort of supports that were needed and we're definitely not there. So tonight's title, by the way, Frozen in Time, is absolutely perfect because she, like I said, was one of tens of thousands of people who needed so many supports. She did talk about being on social assistance at one time and that she spent her money largely on coffee, cigarettes, and lottery tickets. And I thought, what an example of how much more support this woman needs, is that even the little financial money she was getting, there was no supports around her to say, let's budget it and let's try to get some more healthy eating or spend it properly so that you can have some sort of good health. But something Peter said really stuck out to me, and that was the problem with lacking the capacity to plan. And I often came across that when I wrote stories on poverty, was that when you're living in poverty, and certainly someone like Margaret, you're in survival mode and you're just living day to day and sometimes just hour to hour as Margaret did. And there's no such thing as long-term planning. It's very short-term. And Peter also mentioned sense of abandonment. And boy, there's nobody better example of that than Margaret, because she was abandoned by the system and really had no chance at all of surviving. And like I said, it's incredible that she survived as long as she did, because she was in constant survival mode and really needed so many more support. So I hope that her story shed some light on exactly the sort of holes that are in the system and the things that we need to do, because the lesson I walked away with Margaret's story is we need to do better. So I hope that was a help, because I really think that's we all have a lesson to learn from Margaret's story. And as I've said to people, we have to show that Margaret's life mattered. Thank you.
Sorry, are we unmuted now?
Yes.
You are. We can hear you.
Okay, I think Sandy's still up. Or maybe frozen. We may have lost Sandy. That's okay. I'll continue on here. Thanks so much, Denise, and for
Thanks,
your
Tom.
certainly powerful words, and really a reminder of just how important it is to invest in people. Oh, here's
Sorry,
Sandy
Tom.
back. Sandy
Yeah,
is
I don't
back.
know. I'm like really, technology hates me today, and it's the feeling is mutual. That's all I have to say. So I'm sorry about that. And I just want to read the quote before I introduce, from the book. What I want to say is that there's a quote on the back of the book that her name was Margaret. It says, "Being sick with mental illness shouldn't lead to homelessness and premature death. Let the intimate story of Margaret touch you, make you weep, motivate you to rage against government's inaction, then inspire you to work for change." And that's from Olivia Chow. So
Mhm.
I think that perfectly sums up your work, Denise. And so thank you for that.
Thanks,
Okay,
Sandy.
so it is now again my complete honor to introduce my colleague, MPP Monique Taylor, who is the MPP for Hamilton Mountain. Now, Monique was first elected in 2011, and she's been serving for 12 years in the Ontario legislature. And I can tell you, there isn't a day, a minute that doesn't go by when Monique is not advocating fiercely for people that are struggling and have challenges in our community, whether it's families with children with autism, or whether it's people suffering with struggling with disability or income disparities. Monique is there, and I can assure you, I sit beside her in the legislature. She's fierce, and she will continue to advocate. It doesn't matter who's in the room or who she's speaking to. Monique is a champion for making governments, if they're not going to move to action, making sure that they feel the heat. Let's just say that. And so, with the complete love in my heart and admiration, I'd like to introduce MPP Monique Taylor, my sister and my friend.
Oh, I need to unmute. Oh, I should have done this first.
You're unmuted.
Oh, we can hear you.
Okay, you did it. Okay, good. Thank you so much, Sandy. It's fantastic to be here with you tonight. I'm sorry that I'm sitting in my car, but it was my only opportunity to make sure I was here on time with you, and just to share a few words. But first, I want to start with sharing thanks. And the first person that I need to thank is Dr. Sally Palmer. I have been the critic for children, community, and social services. Well, children for the full 12 years, but community and social services kind of got lumped back together again in the last year or so. And Dr. Sally Palmer, I'm just going to call her Sally from now on, has never given up. I can tell you, I have never met anybody so relentless and just so focused on people who are vulnerable in our community, who are put into legislative poverty of no fault of their own. And Sally has committed to continuing to push back on the government, to raise awareness, to have petitions signed. I mean, I have never seen so many petitions come into the legislature. I think I have read the petition probably 17 times. I think that's Sally's numbers because she keeps track of that too. And she knows exactly who's read those petitions throughout the legislature. And that's dedication and commitment. So thank you, Sally, for all of that hard work. And I know you have people around you. I mean, the Hamilton Poverty for Roundtable for Poverty, ACORN, the Sara, Mayo, Social Planning and Research Council. I mean, there's so many of you who work so hard to increase the rates. And we all know it's the right thing to do. It's just so unfortunate to see these callous governments not pay any mind. Roughly 900,000 people in Ontario rely on ODSP. They rely on it to pay their rent, to buy groceries, to pay a bill. And yet we see so much of that is just not possible. We're looking at rent in Hamilton for a 1-bedroom, just over $1,800 a month. When a person on ODSP makes $1,227 a month, it's not hard to do the math there to see that if a person is displaced from their home in today's day and age, they're going to be on the street. And we are definitely seeing so many people ending up on the streets in tents, and our shelters are overflowing. People are couch surfing. I literally hear from people every day who are at fear of losing their home. They've got a call from their landlord. The landlord set up a meeting. Whatever it is, it installs instant fear in that person that they're going to be the next one to lose their home. And then they start looking in the ads and the real estate market to see where they're going to live next. And they know it's just not possible. And it's not just people on ODSP, it's working people. So if working people can't make it work, how are people on these barely nothing rates of ODSP and Ontario Works making it? It is absolutely horrifying. We're also seeing the inflation rate, the highest that it's ever been in 40 years. People are seeing it when we go to the grocery store each and every day. I think our food prices are up over 19%. Your checks have not gone up over 19% by far. I think the measly $58 that the government provided in the last budget barely covers half a week's groceries. And that's not okay. This time last year, myself, as well as I believe 4 of my other colleagues, decided to take the challenge of doing the social assistance diet. It was a formula that was created years back by New Democrats, where they took 2 weeks and ate based on this formula. When we did it in today's day and age, the formula gave us a $97 allowance for 2 weeks. The minute the $97 came out of our mouths, folks were very clear to share the news that $97 was more than some people had in a month. And to be able to eat and not even think of a healthy diet, but just to eat whatever you could to keep you going is not okay. So I did that diet. I stuck to it. I mentally tried my best to put myself in the position of someone who was struggling. Mind you, I still had a roof over my head and a comfortable one, which many don't. But I still engrossed myself in that because I truly want to. I want to feel your pain. I wanted to know that knowledge of what that felt like. And then when I was done that program, I went back to Queen's Park and I begged the premier, please, if you're not going to do the diet, just go grocery shopping. What he said to me wasn't really nice, so I won't really get into that. But that just shows the state of affair of this government, the same government that's sitting on over $20 billion in surplus. So there's no reason why they can't increase the rates and make sure that people have safe, affordable housing that they can afford to live in and food on their plate at the end of the day, and so it's a terrible state. I know that Tom started this talk today by saying that we have to stay positive, and the thing that we can absolutely stay positive on is the fact that you have good people on your side, because all of us who are here today are committed to ensuring that the rates are doubled, that they are kept up with inflation, and that people have the ability to live in decency, which is exactly what is not happening in today's day and age. I want to once again, the petition, if you haven't read it, I mean, 230 organizations signed an open letter to the premier and to two cabinet ministers. The cabinet ministers have turned over. We all know why that happened, but you know, they still have not. I don't even know, Sally will be able to respond of whether they've even responded to that letter. But please see those petitions. You know, our fight is so much stronger when we band together, when we have allies, and when we can you know, work together to show the government that we are forceful in numbers and that we're not giving up. I also want to commend Tom and all of the the HATS program and the hard work that's being done there to try to find some suitable housing arrangement. You know, I know they're pilot programs, but I think we can do good by them. I think if we have affordable housing, small, comfortable, affordable housing that people can survive in and stay warm in, that we will see people do better. Allowing people into the employment field. You know, you can't go to work when you don't have a place to lay your head at the end of the night, when you can't take a decent shower or eat something proper. How do people expect you to go to work? So I think by providing these tiny homes, by some stability, we can help people alleviate the pressures of their homes, help them get back on their feet, help them through the employment programs, and really help them just, you know, have that healthy environment of life. So congratulations for getting us another step further. I know it's been a long time coming, and a lot of work has gone into that, but know that it is recognized and that there are many people out here in the community who are cheering you on and always have your back. So I don't know if there's much more that I need to say. We all know the state of affairs that we are in this province, and I think that just once again coming together to have these town halls, to have the ability to share stories, to Denise, the story of Margaret, I can't wait to read that book. You know, I think that is the perfect example of putting a face to the number, and because it's not just, you know, 9,000 people on ODSP, that's 9,000 actual individuals with families and, you know, a face and you know, they're real human beings. So the story of Margaret will definitely shed some light into some people who just don't have the ability to understand what people are facing in our community. So thank you for doing that work. I'll scoop Sandy's book and have a read of it. I appreciate that. So thank you again for allowing me to participate in these forums. I wholly commend all of you who work so hard to make sure that this happens and continue to march on in the fight towards some fairness and stability to our communities. So thanks.
Thanks, Monique, so much. And I'm pumped now. So you've really inspired us. So thank you for that. And thanks for always fighting on our behalf and certainly on behalf of those who don't have a voice with this government. And that is certainly a growing number of people. So thank you for all you've done. I'd now like to introduce Dr. Nadeem Akhtar. And I haven't had the chance to meet Dr. Akhtar in person, but Nadeem reached out to me a few months ago because he was running a screening of a film that I had seen a couple of years ago called I, Daniel Blake, and it's a fictional story, but can be based on any number, I think, of individuals really up against an incredibly challenging social assistance system. So Nadeem is a psychiatrist here in Hamilton. And so I've asked Nadeem to join us today and say a few words about your perspective on social assistance. So Nadeem.
Thank you. Thanks, Tom, for inviting me. I mean, it's a real honor, I must say. Such compelling stories and sort of nuggets of information. As an introduction, you know, I'm a psychiatrist. I'm also an associate professor at McMaster. And since 2017, I've led a filmmaking team called Cine Psych, which is a psychiatry filmmaking team dedicated to anti-stigma work. And it was in that capacity of us running events that I'd kind of reached out to you, Tom. And although I've been in the world of psychiatry for about 20 years, a decade of that has been in Hamilton. So I've kind of seen what's been changing in the city. Generally speaking, I'm going to talk a bit about the world of psychiatry. As a psychiatrist, I'm able to diagnose, prescribe, and treat a range of conditions. But they are just that. They're these kind of very well circumscribed conditions which respond to medication. What I can't really do is treat social circumstance. And that is quite unfortunate, because social circumstance in itself, social factors, we know they create morbidity, they obstruct recovery from illness. And if you leave it long enough, they can actually precipitate illness. And by far the most significant social issue that I see clinically is financial insecurity. And in my workplace, time and time again, I'm asked to police people. I'm asked to police the public when it comes to finances. So workplaces will ask me to comment on a person's ability to attend to duties, often well outside of my scope as a physician. But the very fact that they have to jump through those hoops is extremely off-putting. On the other hand, when it comes to the government programs, they require me to prove that my patients are disabled enough to be assisted. And even when they do qualify for things like ODSP, we know that's the topic of today, that what they receive is not livable. And we know that without money, people lose all of life's basic necessities. So you don't have food, you don't have shelter, you don't have clothes. And it's not just for themselves, it's also for their dependents too. But the other thing that they lose is dignity, because society looks at us through a lens of productivity. If you can't work and you can't be productive, you lose dignity, you lose worth. The other thing that we need to remember is that we all kind of walk the same tightrope. At any moment, illness, circumstance can push us and render us, unproductive in the eyes of society. And if you've already started off somewhat disadvantaged due to poverty, neglect, trauma, or caregiver illness in your sort of formative years, you've got less of a safety net if you do fall. And increasingly now in my clinic, I'm seeing this kind of novel situation where people, because of rent hikes, are living out of their cars, and they're people that are working, and the people that are on disability, they're really struggling. They're basically not eating. They can't afford food. And so when they come into the clinic, anything that we've got sort of in our cupboards, we give to them because it's just inhumane. Another problem that I encounter clinically is that people either have to be 100% well and dedicated to working, or they have to be 100% disabled. And we know that doesn't work like that. There's an in-between, and people aren't really supported with that. And it is really quite impossible to treat a patient adequately if their basic human needs aren't met. And this isn't a new idea. This is Maslow in the 40s, a psychologist, suggested that there's a hierarchy of needs. So at the bottom of that hierarchy is the scaffolding, the core things that we all need to be motivated and to function. And those core needs are physiological, so food, shelter, etc., followed by safety. You need safety in your kind of person, financial safety, and safety of your health and well-being. It's quite sad, actually, that 80 years later, the systems haven't really fully embedded those kind of concepts and ideas into how we assist the population. And of course, today we're talking about the limited funds as well that social assistance provides. And unfortunately, that's an undeniable reality that needs addressing. But again, I would like to put in a pitch for supporting people before they hit rock bottom. It's definitely better for their mental health. And one way to do that is to give them a universal basic income. I had several patients that received that when there was a pilot, and we noticed that their mental health improved significantly. And I know that's anecdotal, but the literature also somewhat supports that. And the reality is, if people's basic needs are met, the chance of recovery is so much greater, and the time to recovery is so much shorter. And then you give them back that sort of dignity, which is robbed of them because of the way society sees people that can't work. So that's my view and my perspective. I tried to keep it as quick as possible.
Thank you.
Dr. Akhtar, I can't imagine how you were able to keep it as quick as possible. I can't even imagine. I mean, what you described to us, I mean, it must feel like a tsunami of need and falling on deaf ears. And I just want to thank you for the work that you do and for advocating for your patients. You know, there is so many. There's so many ways that we're failing people, and I know that the healthcare and the medical system is a difficult place to be right now. So I just want to again commend you and thank you from the bottom of my heart for being there and being on the front lines for folks that need you. Absolutely. And so thank you so much for that. Yeah,
well,
absolutely.
Thank you for your kind words, Sandy, and also both of you, Tom, Sandy, and thank you for inviting me, and thank you everyone for giving me the time to kind of say that piece. The reason I went into medicine was because ethically I felt that and especially psychiatry, ethically I felt that my role in life was to kind of assist and support people and help them get back to their best. And I really do, fundamentally feel that it's becoming more and more problematic to do that when it's so obvious what people need, but I have no control of that. Pharmaceuticals don't fix poverty. That's that's impossible. I can prescribe lots of things, but they're not going to fix poverty. They're also not going to fix the fact that somebody's rent has been hiked and now they're living out of their car. And it is that kind of sad reality that we're facing. And the medical system has always provided a bit of pastoral and social care, but I think it really can't do that anymore. And also it's not sufficient. I also feel it's unfair because it kind of changes the problem from a system issue to an individual issue. Because the reason people are kind of struggling, if they don't have money and they don't have a house, is because of those things. It's not because, they have a depressive illness that needs treating. I mean, of course they're going to get depressed because anyone would. But I do feel it's a slippery slope when we start to make the problem about the person and not the system. But thank you.
Yes, absolutely. And so many of us on this call know how often this is turned into a moral judgment of people. And we know that that is not the case. And I, for one, honestly would like to, everyone on this call tonight, all the speakers have so much to share, but I would love to hear more from you maybe at another day, because I think that your insight into this system that's failed us would be extraordinary. And I do also just want to say, I don't know how to give you, even if you feel that you are failing in the system on any given day, you need to know that the individuals that you're seeing, they need you. And so again, I thank you for doing this heroic work. Thank you so much.
Thank you.
Woo. Yeah, honestly. Well, now the next speaker that we're going to hear from, I'm going to introduce, is Laura Cattari. And Laura, I've known you also for a very long time. I think you at the very, very beginning of the Hamilton Roundtable for Poverty Reduction. I think that was way back in the early 2005. I know that we met then. And my immediate and lasting impression of you is that this is someone that had lived experience, but was so fierce and brought to it not just lived experience, but brought to it the kind of data that we need, and also just your strong speaking truth to power presence. You're relentless doing this. I've seen you present to all kinds of people, so I just want to commend you for your presence. I know that you are now the senior social policy analyst with the Hamilton Roundtable for Poverty Reduction, and I know those two combinations of your skills have served Hamilton well and will continue to do that. And so I'm really looking forward to hearing from you tonight, Laura.
Thank you so much. And I'm so happy that I told Tom to email Nadeem and just get him on here, because we need him. We need him in our fight. So thank you so much for coming out tonight. I'm here to talk about the Canada Disability Benefit tonight. And to do that, I'm going to give a very, very short history on how this came about in the first place, what's happened with the process, and where we're going with it. So in Canada, we're looking back at the 1980s when this idea that we need to support people with disability came about. And it's really interesting because there's people like Sherry Torsman who were on parliamentary committees back in 1981 to find out what we were doing for people with disabilities across Canada. And honestly, the report came out and said, we're not doing really anything for people with disabilities. And quite frankly, if you look across Canada, there are still provinces that don't have a disability program, that everyone is on general welfare and there's no drug benefit. So the disparity right across the country is really alarming. So back in 2017, the pressure started to get higher with the federal government. We were going to Geneva, and I had the honor, privilege, and quite frankly, really humbled to be able to go to Geneva, speak about rights of persons with disabilities, and testify that there's no reason that being disabled should mean poverty and homelessness. There's no reason that 50% of homeless individuals have mental health issues. And that's the country we live in, and that's precipitated an even stronger push because Canada wanted to be seen as this, human rights leader in the world. And the reports that were coming out of, I believe at the time, there were 13 organizations that went out to testify in 2017. Canada didn't look good. So this has been going on up on the Hill for a very long time, decades. Then, more recently, we had a minister for disability and sport who happened to have a disability and also an Olympian. And she was really instrumental on the Hill and talking to people in her caucus that this needs to change. People petitioned her. And we came out with this announcement that we were going to produce a plan for people with disabilities in Canada. And with that plan, a benefit. Over the past year and a half, people have submitted to the federal government proposals around an act they put up. And they also went to the Senate to amend the bill that the government proposed. And I have to tell you, as a policy analyst, it's pretty incredible, their definition of adequacy. At the Roundtable, we were talking about fix the gap. And so their definition of adequacy is awesome. What they came up with was everything we would want. The minister responsible is going to be the same minister that deals with all other federal programs, EI to old age security, CPP, pensions. And we want something like that rather than a straight tax credit, because persons with disability have cyclical illnesses. You don't want just a tax credit. You want a program that can respond to working, not working in a timely manner. CRA doesn't do that. They don't go back and fix if your income has changed, and people could be worse off with the benefit if we did it through the tax system. The other thing that comes up, And this is when I'm worried going forward. One, consultation seems limited, and the consultation isn't the co-design that disability groups have asked for across the country. It's basically, they'll be asking the questions and we'll be giving the answers if you're on their list, which is hard to get on. And that's not what we want. We want to hear from people, from individuals, not just organizations that have a position, but we want it to be informed by people with lived experience to say, hey, if you do this, this is what's going to happen to me. And when making up regulations, that's really important. And that's the step we're at. It has royal assent. The act went through. So now it's up to making the regulations. I think the hardest part is going to be making sure that the definition of disability is inclusive enough for everyone in Canada. The federal government has a habit of making very high bar to what they consider disability. Right now in Canada, I'd like to say Ontario actually has the best definition of disability. We talk about not only employment, disability isn't just about the ability to work, it's also how it impacts your social life, your family life, and your ability to take care of yourself. And it's not that you can't work, it's that you're going to have significant barriers. And that's what Ontario says. There are other jurisdictions in Canada that it's only severe disabilities that get any help at all. And we really don't want that happening. So going forward, it's making sure that disability groups in Hamilton have an opportunity to contribute. Maybe we can collaborate, and making sure that we are knowledgeable and in contact with groups like Defend Disability. And I saw Trevor is on the call, so yay. And the ODSP Action Coalition and everyone out there to make sure we really nail this the way we want to. I think it's an opportunity that we won't get again. And quite frankly, if there is an election and we have another government going through, I know the leader of the opposition at the moment will do tax credits for people that work, but they're not really interested in this type of program. So yeah, we got work to do. So thank you for listening. I think I took up more than my 5 minutes, so I'll shut up. Thank you.
That's okay, Laura, because we love listening to you and your knowledge and certainly courage and power as well. So thank you so much for always staying on top of this issue and for helping us to make sense of these critical income security ideas. Next, I'd like to bring back, because this is the second time Tamra is going to be presenting at one of our forums. She did so last time and it was quite powerful. And so when Sally and I were talking, we thought it would be a really great idea to bring Tamra back and talk about her personal experience as somebody who knows the system all too well. Tamra.
Thank you so much. As I was introduced, my name is Tamra, and I am on the ODSP program. My story is not unique. I know of many people in my community living on the edge of homelessness or starvation, and I'm asking you to take just a few minutes to think of those less fortunate. This situation could happen to anyone at any time. It just takes one accident, one job loss, and this could be you. I've been listening to the other speakers, and you're speaking about Hamilton. I live in a small community in Norfolk County, and we have the same issues here. Believe it or not, a small town, and we have homeless on the street. We don't have shelters here. We have a warming shelter that's in the winter, but other than that, there's nothing the municipality has provided. About 9 years ago, I myself was involved in a head-on collision, and I've been dependent on social assistance ever since. I feel helpless on a fixed income and rising prices everywhere, from rent, groceries, utilities, fuel prices, and the stress is unbelievable. What it does to your mental health is just, it's incomprehensible. I feel that the world is closing in on me, and it's getting worse with rising inflation. And our rents here are set by GTA rates because most of the rental properties in our community are owned by big corporations from big cities, and they're charging the same rates. The car accident I was in left me with severe whiplash and nerve damage in my back, and I'm unable to work. I can't sit or stand or walk for long periods of time. And it also limits the amount of time that I spend driving, which means I can't visit my 93-year-old grandmother or my 18-year-old granddaughter as often as I think is necessary for my own mental health. I had a decent paying job. I was making about $2,000 a month. When the unemployment from my car accident and that ran out, Ontario Works gave me $733 a month. That's nothing compared to what I was living on. And I had to borrow money from my family, knowing that I'd probably never be able to pay any of it back. It took over 18 months to be accepted on ODSP. I went through all kinds of tests and medical appointments because I have what they consider an invisible disability. To look at me, you wouldn't know I'm disabled. I had to prove it. And it's really hard when it's a back issue. Currently, we've been given a 6.5% raise. That's not much. It has gone from $11.69, which we got last year. We got a 5% increase, which was like $58. They've given us 6.5 on the 1169, which brings us up to about $1,307. And it's still not enough to pay for rent and food and necessities. There's no luxuries such as meals out, new clothing, even a trip to the hairdresser. It's been, oh God, 5 years since I've seen a hairdresser. I pay about $8.90 a month in rent, and I can't afford to move to a safer building. But then again, there's no affordable housing available. What the government considers affordable and what someone living on social assistance considers affordable is totally different. All my clothing comes from thrift stores, which are my new best friend, but those prices are rising too, making it difficult to afford even an item or two. Going back to the 18 months to get accepted, you do receive back payment in a lump sum. And I use that to partially pay back some of the money that I had borrowed from family, but I still owe. The food that I'm able to purchase is the cheapest that I can find. I'm checking the reduced bins, things that other people wouldn't be buying. There's no more fresh fruit or vegetables or good meat. And the food provided by the food banks is usually expired or about to expire, and the portions are very small. What I found living on such a limited diet is it's created other health issues, such as dental issues. In the last year, I have had to have 90% of my teeth removed and had to get plates, and ODSP sends you to discretionary with Ontario Works, and they covered not quite 2/3 of the cost. So then when you're living on a fixed income, you got to try and find that extra money so that you've got teeth. Can't eat without teeth. I know I'm not the only one in this situation. And maybe, you know, I'm just hoping that some of my story will make an impact and make people think that when you see someone on the street, see them struggling, that they didn't purposely put themselves in that place. It happened. Poverty costs everyone. The annual cost of poverty in Ontario has been measured at least 27 billion. From loss of tax revenue and increased expenses in the health and justice system. And this is from Liam Briggs, Feed Ontario 2019, the cost of poverty in Ontario. We need to have the rates of OW and ODSP raised to meet the rising inflation. People are starving or are homeless because we can't afford the price of food or a decent home. We need a new government, one who cares about people who have fallen into poverty. Help us tell Doug Ford and Justin Trudeau that poor people matter too. And if you're asked to sign the petition to raise the rates, please do so every minute. Thank you for listening.
Tamra, I want to thank you for telling your story tonight again. It's, you know, it's humbling for all of us to really understand that, you know, an accident or an illness or some misfortune that befalls us, we would be in the same position. You know, what's that expression there? But for the grace of God, go I. And so I want to thank you for sharing your story. I also just can't not remark on the fact that you have a 93-year-old mother and an 18-year-old granddaughter. So that's pretty special. I just wanted to say that. So,
I actually, I turned 65 the end of May, so I'm currently on the pension, which gives me a little extra, but considering how much I owe family for helping me through the time I was on ODSP, I'm making efforts to pay them back because who knows, I may need them again.
Absolutely. Thank you very much. So the next speaker that we're going to introduce is Sara Mayo. And Sara, I just have to say, Sarah's a planner with the Social Planning and Research Council. And I just have to say, I think the SPRC is pretty well represented tonight, because I used to work at the Social Planning Research Council. I know that I saw Ted Hildebrand and Craig Foy, all alumni or current people at the Social Planning Research Council. And so what I want to say is that, you know, Sara, she's a social planner, she's a GIS specialist, provides the kind of reports and the data that we need. But I know that Sara also stands on the front line because I just saw her today doing that. So Sara, it really is an honor to share this evening with you, and I'm looking forward to hearing what you have to share with us tonight.
Thank you, Sandy. I am so thankful for you and your work now, and also your work way back when, because you're the one who connected me. I knew a bit about the Social Planning Council before, but you really connected me in a way that changed my life, and I've always appreciated that, Sandy. So I also want to thank Tom, because I said to Tom, I said, you know, is anyone, we need to talk about the PNA. And he was like, okay, you do it here. And I was like, but I don't know anything about the PNA. But you know what? You just have to do it, because I did find out in finding out more about the personal needs allowance that nobody has actually been tracking it at all. It's not in the welfare incomes report because they're across Canada and it's complicated. And there's no like government database. It doesn't show up in anybody's like tracking of Ontario disability or OW payments. And so the personal needs allowance, I have some great slides about it. So thank you, Tom, because the only thing I knew about the PNA was in speaking to residential care facility tenants was just how horrible it was. And that's all I knew. So I was like, okay, well, let me find out more. And here are my slides. Very quickly, I have tracked exactly how bad it is for everyone to see. So this first graph here is the PNA. So PNA is an amount that is given to residential care. There's other people who get it, but my main focus on this has been residential care facility tenants. There are about 700 in Hamilton, many more across Ontario, and their food and lodging is paid, not by them, but by the ODSP system in a different way. And they are given 100. Right now, it's 149. I've tracked it back to 1999. It was 112 back then, and it is not like it is one line in the regulations. And it used to be called PNA in the regulations. Now it's not even called PNA. It's just an amount in the other cases category. And it's an amount for people who live in this long list of different types of housing and of supportive housing. And so it's not even called the PNA anymore. It's just horrible. And it's because it's like the regulations are thousands of words and lines, it gets forgotten. And so it was 112 for a long time. Oh, and then it was 116. And then, there was $2 increases every year for a little while. And now, not randomly, ever since Doug Ford's government has completely forgotten about it. It's like they don't know about it because they have not increased it at all at the time where we have the highest rate of inflation we've seen in our lifetimes. So PNA, if 112 in 1999 was an adequate amount, which it wasn't, then we would need to be at least 190. But even that would not be enough. And I was thinking like, inflation, do people, like in terms of arguments for the everyday person, are they like, well, my wages didn't have an increase for inflation, so how is that fair, right? So on the bottom here, I have a chart about median income. Like, okay, maybe let's not talk about inflation, but let's just compare it to median income. So as a percentage of median income, PNA used to be 2.5% of household income in Ontario, and now it's 2% of household income. And then similarly, OW, these numbers include tax benefits, but 13% used to be 13% of median household income, and now it's 11%. So even forget inflation and whose income hasn't or not increased in terms of like just comparing who has income and who doesn't, and the how low can we go? Are we going to go down to 1.5% for PNA? And PNA has to cover, and so many speakers, Tamra, like you said, hairdresser. I hadn't even put it on the list. I was like, I should edit this and add that. There's so many items that just think about our everyday life that aren't the food, everything in your home you still have to pay for except the food and the heat, the electricity, but like internet is not paid for. And so this brings me to a really amazing piece of research from our friends at McMaster and the Greater Hamilton Health Network and St. Joseph's that did interviews with residential care facility tenants in Hamilton, and also looked at their medical charts, so kind of could get a medical assessment of their diagnoses and things. And it's just an amazing piece of research. No one has ever really given us a concrete idea of what is this population, what ages they are. There are many older adults in this population. 64% of the people interviewed said they had no access to the internet, email, or phone. They're cut off from society, from life, from everyday participation. And obviously PNA came up in the interviews they did, and as something that was, they could not survive on that amount. I'm going to be writing this up as a blog post on the SPRC's website in the next week, because I realized, well, wait, I'm glad, Tom, that you forced me to do this, because we need to be talking about the PNA. Like, I mean, and it's so ridiculous. It was $2, like basically, you know, it's so few people. It really is a drop in the bucket, you know, compared to, as you say, the surplus in Ontario. This is a population that is our most vulnerable people. It is very much the population, like Denise Davy talked about. Margaret Jacobson was living in an RCF facility at the time. It was called second level lodging, but this is exactly the population that is the most vulnerable, needs our support, and needs to live in more dignity than $149 a month, $5 a day. Thank you.
Thanks, Sarah. That was great. And it actually brought back a lot of memories, because I'm aging myself here, but I can remember back in around 2000, 2002, when the personal needs allowance was at $112 a month. And there's still a fantastic local group called the Residential Care Tenants Coalition that was fighting even back then to push this forward. I can remember going to Queen's Park and arguing with it was either the Harris or Eves government of the day that it needed to be increased. And certainly it was something that residential care facility tenants themselves were very much behind in leading. So thanks for this. And we will look forward to seeing more information as it develops and as it's posted. So thanks so much for your work on that, Sarah. I'd now like to ask Janica Glasnova from ACORN Hamilton to say a few words. And as I think everybody on this call knows, ACORN has been an amazing community organization, a member-based organization that has done phenomenal work on so many different fronts, but in this case on income security as well. And Janica is going to talk to us a little bit about the Ontario Works experience. So Craig, can we, I think we need to spotlight Janica.
It's Janica, thank you.
Oh, Janica, sorry. Thanks.
Thank you. Hello, everyone. My name is Janica, and I've been a member of ACORN since 2019. ACORN Canada, the Association of Community Organizations for Reform Now, founded in 2004, is an independent grassroots organization that fights for social and economic justice for low and moderate income communities. ACORN started organizing in Hamilton in 2017 and has grown to have 4 neighborhood chapters: Downtown, Mountain, East End, and Stony Creek. If you are a tenant in Hamilton on this call, please reach out if you want to get involved. I am now going to speak about my experience with OW, Ontario Works, and ACORN's campaign demands to the province, and touch on what Hamilton tenants are facing. Due to a sudden onset of long-term health conditions in 2018 that took me out of my work, I have now been on and off Ontario Works for the past 5 years. Many people go on OW if they cannot find work or have not been able to get onto ODSP. In Ontario, OW recipients only receive $733 a month. I am lucky to receive a little more because of the special diet funds that Ontario Works has allowed, which still doesn't cover anywhere near the current market rates for 1-bedroom independent units that landlords are allowed to get away with charging. As Chris Waterman has mentioned earlier, 1 bedroom is now costing $1,600 a month plus utilities. Tenants on OW face becoming homeless if they lose their apartment or will stay homeless and further become disconnected from their former hard-earned lives if already in that situation. Many landlords, if not most, will also discriminate against tenants on social assistance and not want to rent an apartment to them. We need more supportive and rent-geared income housing for tenants on social assistance. While at the Access to Housing booth on Monday to sort out a dispute, I was asked by the main supervisor there, "Have you tried looking in a different city?" My reply was as follows: "How is that easier when OW and ODSP not only cut you off of funds when you relocate elsewhere outside of your primary jurisdiction for more than 2 weeks, but you become forced to restart your application process from scratch as well? Pray tell, why is that even a recommendation or even a question that is being allowed to ask when Hamilton used to be the best reputation for being housed many years ago? What happened? Upon leading my meeting with the main supervisor of ATH on Monday, her regurgitation was sadly the same thing I've heard over and again all of these many years. Talk to your MPP. If you won't step up to help fix the problem or allow others the opportunity to, then who will? ACORN is demanding the province raise ODSP and OW to a minimum of $2,000 a month to increase the housing allowance to match where the tenants live and stop clawbacks on spousal income. Right now, across Hamilton, tenants on social assistance are fighting to keep their homes from rent eviction and dem-eviction and above guideline rent increases. We have to fight because we have nowhere else to move to. These are our homes, and greedy investors and landlords are being allowed to kick us out to make more money to suit their own self-centered agendas. We deserve better. Government on both sides need to step up. We need to stop supporting developers and building new homes on Indigenous lands and stop building on our precious farmlands and instead refocus efforts on renovating old spaces with pre-existing buildings into regularly and safely habitable spaces once again. Ambassador Matthew Rycroft of the UK mission to the UN in 2015 at the Security Council open debate on children and armed conflict was quoted by reminding us that a society is measured by how it treats its most vulnerable is always the measure of its humanity. Thank you to all the speakers today, and we look forward to working with our allies to continue to demand social assistance rates be increased permanently in Ontario. Lastly, if you are in Hamilton, we invite you to join us in support this Friday at 1052 Barton Street East. Low-income tenants are fighting to defend their homes from rent eviction. Please meet us at 11 a.m. in front of the building. Thanks again.
Thanks, Yannicka, and thank you for that strong call for action as well, and for the work you and ACORN members continue to do in this community. I'd now like to call on our penultimate presenter, and that is Claudia Calabro from ISAC. And some of you may know ISAC stands for the Income Security Advocacy Center, but it is a incredible organization that helps not only ground a lot of our discussions on social assistance and income security, but really keeps these issues in the spotlight. So Claudia, I'd like to ask you to say a few words, and thank you for joining us tonight.
Thank you so much, Tom, and thank you, everybody. Yes, as Tom said, my name is Claudia. I'm a community organizer at ISAC, which stands for the Income Security Advocacy Center. ISAC is a specialty community legal clinic, and we're based in Toronto, but we take up issues impacting people living on low incomes who live all over Ontario. Specifically, our work is focused on advancing the systemic interests and rights of low-income Ontarians on income security programs like provincial social assistance and people who experience low-wage precarious employment. If you want to know more about us, you can check out our website. I will put a link in the chat later. I just wanted to thank everybody for the organizers of this event for allowing me to kind of hop on at the end of this really important town hall and virtual community space. And also to thank MPP Taylor for referencing that letter that we sent last summer. And to answer your question, no, we did not get a response from anyone in government. 250 plus people wanted an answer. And the answer was less than satisfactory. But I wanted to just say today, you know, it's obviously no secret that social assistance rates are too low. They have been too low and they cannot remain so low. You already know, we've gotten some facts and figures and personal stories throughout the evening tonight. And, I just wanted to bring it back to the fact that, so many different groups and individuals have raised this issue of extremely low social assistance rates in many different creative ways since 2018, when there was a major change in government in Ontario. And if anyone remembers what it was like in 2018, you remember that maybe yourself or people, who were connected to progressive movements were worried, and we were right to be worried. The new government at the time initiated they started several different conflicts and enacted cuts to funding for public services, and including a cut and a freeze to social assistance. There were some planned increases that didn't happen. They also threatened to change the definition of disability to make it more stringent and exclusive, making it harder to be approved for ODSP. And Laura mentioned earlier that Ontario has a pretty good definition right now, so that was a huge, huge threat. So I flagged that time frame because that was the last time that a Raise the Rates coalition got together to start discussing how we can get some serious movement on social assistance rates. I won't rehash much more because we're at the end of the night, and we also don't have time to talk about all the stuff that's happened since 2018, including the fact that we have been through a whole pandemic, are still in a pandemic and dealing with its impacts. But I do want to highlight that organizing around social assistance rates never stopped, even if it took on different dimensions during the pandemic. For example, you had the ODSP Action Coalition, which has held multiple rallies at Queen's Park in collaboration with the Ontario Disability Coalition and the Disability Justice Network of Ontario. Many different food banks and food justice organizations have initiated campaigns on increasing the rates. Healthcare providers, health justice organizations have been raising this issue in whatever way they can, just as Dr. Akhtar said. And you know, healthcare providers can see the impacts of these extremely low rates on people's health. And just as MPP Taylor mentioned, you know, that at ISAC, the clinic that I work for, put together this community supported campaign last summer, calling on the government to double social assistance rates. Community legal clinics across the province jumped on this immediately because so much of their work involves fighting with ODSP and OW on behalf of their clients who are being nickel and dimed, you know, and coming into conflict with these hundreds and hundreds of rules that have to be followed for social assistance recipients. And also, of course, I have to mention the amazing work that Dr. Sally Palmer and her amazing crew out in Hamilton and the surrounding areas have been doing, getting those petitions signed and submitted to the legislature. But all this to say, there's just a few examples of how this work has continued since the last Raise the Rates campaign came together. And with all of this immense pressure that we collectively built up, we did achieve some important changes to ODSP, such as making sure that the ODSP rate is increased annually based on inflation. But that's just starting this year, and it doesn't account for the impact of previous years' inflations on social assistance checks. And even with these little changes to ODSP, OW has been completely overlooked. So we said this last year in our Double the Rates campaign, and we still believe it. Incremental, unpredictable, small bumps to social assistance rates are not going to bring social assistance incomes anywhere close to a livable rate. The longer people live on social assistance rates, the longer people living on social assistance rates are forced to wait for these small increases, the more they will be forced to suffer food insecurity, ill health effects, housing precarity, risk of abuse, and increased vulnerability to violence. So we say enough is enough. I came here today to tell you that several organizations have been working on a new iteration of a Raise the Rates campaign. And we want it to be province-wide, and we're going to launch it soon. We're going to launch the campaign soon. I don't want to spoil the details, so stay tuned. This is my little, it's coming. And if you're here today from an organization, please get in touch with me if your organization wants to join our small action-oriented steering committee who's working on some of these detail things right now. If you're not from an organization and you're just a person, we need you to join too. So you can follow ISAC on Twitter for the time being. There's going to be a whole of campaign stuff for the time being. You can follow us on Twitter. You can email me. I'll put my email in the chat. And yeah, you'll be able to hear more about how you can join this campaign soon. So that's all I have to say. Thank you again for inviting me and giving me your time.
Claudia, thank you for all of this. You really piqued all our interest, Raise the Rate campaign. I would be more than happy as a MPP in the legislature to support this in any way that I can. And I just, want to say that we called this these panels that we're having frozen in time because it wasn't just from 2018, which was egregious, but it basically hasn't been any increase. We had Mike Harris who cut the rates, and there was really basically no increase in their 15 years of Liberals at all. So, frozen in time goes back sadly, even before the reign of Doug Ford. And I just would like to just say, when it comes to Doug Ford, but what I want to actually say is that they're sitting on about, at latest estimates is somewhere billions, tens of billions of dollars in unallocated surplus. So that they do, they have the money. It's just political will, which is something that Tom identified at the very beginning. And the idea that that folks should be going cap in hand, begging this government for this paltry amount of money is just disgusting. I don't know what other else to say. So we will keep it up, and so thank you for that. And finally, I want to say to Tom, your perfect use of the word penultimate, because now we have the ultimate speaker to round us up tonight, and that is Dr. Sally Palmer. And I know that everyone tonight I don't need to explain to you how formidable Dr. Sally Palmer is. I'm sure all of us know her work and her how relentless she has been at this for years and years and years. Now, I know that she is the chair of the Hamilton Social Work Action Committee, but that really just doesn't explain the depth of her commitment to this and how dogged she is between writing op-eds, between it's just phenomenal campaign with your petitions, which I have also, like Monique said, read stacks of them in the legislature. I've seen you sitting in the legislature, keeping an eye on some of those scallywags on the other side. So I just want to say, Dr. Sally or Dr. Palmer, that I personally thank you so much. We, as like MPP, Monique and I, we do our job in the legislature, but we couldn't do it without all of us acting in all of the areas that we work in. So your work is a real personal inspiration to me, and I want to thank you. And I'm sure many people feel the same. So thank you, Dr. Palmer, for bringing us all together yet again.
Thank you, Sandy. So I'm not going to talk to the speeches that have been made tonight, because you've heard feedback from Sandy and Tom, and I think there've been a lot on the chats that people are really appreciated what you've given us tonight. So I'd like to talk a bit about this petition issue. I have become quite dogged, and my colleagues in the Hamilton Social Work Action Committee sometimes, I think, wonder when's she going to give up. But part of it is that once we started it, I realized we couldn't quit, because then the Premier would think that we'd given up. So we have to keep going. And it also is pretty good at my age to have something that excites you to wake up to every day. A lot of my friends are quite bored, and I'm certainly not. And the group that has helped us a lot is a campaign for adequate welfare and disability benefits. People like Josie D'Amico and Joanne Johnson and Elizabeth McGuire are out there too, collecting signatures. Another thing that's been helpful is to see the attitude of the people we asked for their signatures. They thank us for what we're doing. And it gets more so all the time. I don't know whether because the value of social assistance is getting worse all the time. But I got to go to places like the Terry Fox Run. That was a lot of fun. And we had the Cactus Festival for 3 nights in Dundas. And I was out at the fairgrounds when they were talking about the green belt being infringed on. So it's really been a good time. It's not a good time in the winter. Right now we've got ready with 70 sets of signatures, which is each of them has 27. The set has 27 signatures on it. So it's quite a lot of signatures. And we're ready. We're going to send it between now and next week when the MPPs get back, and they'll find them on their desks, and they'll be told, once you let us know when you've presented it, and we'll send you another one. One of my colleagues on the committee said, well, that might just scare them to tell them they're going to get another one. But people like Sandy and Monique Monique have been really good about presenting. What else did I want to say? Well, someone mentioned, I think Monique mentioned, what kind of response do we get from the ministers? Because we didn't realize it initially, but the ministers of community social services, and there have been 3 or 4 since we've been doing this, they actually get these petitions, and they occasionally write back. And basically, they're saying what wonderful things they've done. They did give 5% to ODSP, but that was nothing compared to the prices going up during inflation. And I think that was actually motivated because there was, just before they gave that raise, there was a rally at Queen's Park, and there were a lot of people there in wheelchairs, and the newspapers took pictures of them. So I don't think that the PC MPPs felt very happy about seeing these pictures of wheelchairs out in Queen's Park. And so they did get that 5%. And then they said they would give a cost of living increase. But altogether, it's been 11.6%, the raise, and nothing to touch inflation. But I'm taking advantage of this group that we've got here tonight to try and involve some of you in getting petitions. We've had people who, in certain, like Stratford Food Bank, collected a lot of signatures, sent them in. Welcome in Hamilton collected a lot, sent them in. And that's a great way to go, because once we get into the cold weather, it's pretty miserable standing out getting signatures in the cold and the rain and the snow. People's hands are all frozen, and so it takes a long time. So that's why we've sort of stacked up the ones we did during the summer, and we're going to need help from people like you. If you could, I thought we could send out send out my email. It's actually pretty simple. It's just Sally Palmer 35, which is the year I was born, at gmail.com. But I'm hoping we can use the emails to send out and ask you if you'll take some petitions and get them signed. Because right now, an awful lot of the petitions are signed by Hamilton. It's really good if we can get them a little broader, and some of you will have connections elsewhere. So thank you very much to the speakers and to all the people that came tonight, and Tom and Sandy for co-chairing. Thanks.
Thanks, everybody. And as well, thanks, Sandy, for co-hosting. And of course, our technical expert, Craig Pickthorn, for keeping us on track and doing all the behind the scenes stuff that made this go so well. So thank you, everybody. We're going to be, as you know, this is recorded, so we will be posting it on our various social media and websites. And Sandy, I'll turn it over to you for last word. But you got to unmute yourself.
Unmute. Now she's frozen.
A lot tonight. I do want to say that when we come, am I muted still?
You're good.
So what I wanted to say is, and just as a third time I said, thank you, everyone. I've learned a lot. I know we shared great ideas, and it can be overwhelming. And I think that we all operate in our own little arena, but when we come together, we see that we, like Monique said, there's strength in us fighting together and working together. So we are going back to the legislature on Monday, on the 25th of September 25th. We'll be presenting these petitions. But if there's anything that we can do, when I say we, I mean Monique and I, anything that we can do to, if you need us to speak to your organization, if there's anything that you think we can help you with, by making connections to the legislature. I know someone says that the current minister is going around meeting with groups, maybe that's something we can facilitate. So please feel free to reach out to my office or Monique's office, and we can all support each other in this work. It's really important. And like Sally said, we have no choice but just to keep fighting, because people are counting on us. So thank you all very much. And go Hamilton, go. That's all I have to say. The solidarity here tonight is fantastic.
Thanks, everybody. Sorry I was
Thank
so
you.
late getting on, like, but it's a new computer and it's giving me a hard time. It's not my fault. It's the computer's fault.
I hear you. I feel you tonight.
Bye,
Thanks,
Sandy, from
everybody.
another Sandy. Take care, everybody. Bye-bye.
Bye. Have a good night.
Thank you and stay well, everyone.